Please refer to the end of this video for important safety information. If you or a loved one suffers from chronic pain, you are well aware of the difficult path to pain relief. It often starts with medications that usually come with associated side effects and progresses to complicated treatments, surgeries, and more medication, many times without effective results. If your life has become defined by your pain, don't give up hope. There's an option you may not have considered that could help you move beyond chronic pain. The option is spinal cord stimulation, or SCS. For more than 40 years, people just like you have been using this therapy to overcome their chronic pain. For certain types of pain, spinal cord stimulation works by masking or interrupting the pain signals as they travel up the spinal cord to the brain. While SCS isn't a cure for the cause of your pain, many people have found it provides significant control over their chronic pain.
I found out about the spinal cord stimulation through my pain doctor.
He showed me the stimulator.
The lead is plugged in.
And I look at him and I say, is that for real?
Wow, those two little wires and that little device does so much.
I couldn't believe it.
He told me I was a good candidate for it since the injections were not working for me.
I tried everything. The medication was not helping me. And I say, yeah, sure, I'm gonna try it.
Anything to take this pain away.
So how does SCS work? First, during a short outpatient procedure, thin wires called leads are placed along your spinal cord. Next, the stimulator that powers the system is placed under your skin and is connected to the leads. The stimulator generates small amounts of electricity, which travel through the leads to the nerves, sending pain signals. The stimulation sensation overrides the pain signals, and instead of feeling pain, you may experience a tingling or massaging sensation. Using a handheld programmer, you can control the amount of stimulation you receive. Is it right for you? Finding out starts with you and your doctor discussing your specific pain and how SCS might fit into your treatment plan.
Good candidates for spinal cord stimulation are people that would like to avoid a more invasive procedure, somebody who has chronic pain in their back or legs, doesn't have a lot of benefit with chronic pain medications or injections, where spinal cord stimulation provides patients with everything that they're looking to achieve as far as pain control without biomechanically altering the spine or causing scar tissue.
Every person is different, but there are some general advantages of spinal cord stimulation. Many people have experienced a significant reduction in their chronic pain, as well as a reduced need for oral pain medication.
The nerve pain is gone.
I came out, I was like a new person. There's no pain. I said, you gave me some medicine or something? No, this is the stimulator.
Many patients with SCS also observe that they have the ability to get back to doing many of the things they used to enjoy doing. Plus, the procedure is reversible. If it is not effective for you, you can stop at any time. Another benefit to SCS is that, unlike other treatments, you can try it and see how it works for you before committing long-term. Before the trial, you and your doctor will also discuss not only the benefits, but also the side effects of the procedure.
You get to take the system for a test drive, you get to use it, and it gets to feel the same as the permanent would because the leads are temporarily implanted without the pulse generator, and see how much it's going to improve their quality of life right away. 7 days later, we'll bring you back in, cut the 2 sutures, slide the leads out of position, and I would say, how much better have you gotten with the use of the spinal cord stimulator? If your answer is anything north of 50%, then you would be a candidate for permanent implant. The permanent implant, the leads are then anchored into position. They're then tunneled under the skin to put the pulse generator in. The leads are plugged into that generator and both incisions are closed up. When I see my patients back post-operatively on day 7, the patients are describing very little incisional pain. They're able to utilize the system well.
After the procedure, you'll be shown how to manage your pain on an ongoing basis with your new SCS system. Once you've had your system implanted, you can expect a few weeks of healing time from the procedure. Some people experience pain relief right away, while with others, it takes a few weeks before results are seen. You'll receive 2 devices to help manage your pain. The first is your pocket programmer for adjusting your stimulation on the go and is designed to fit into your life easily and discreetly. You'll also receive a charging system for recharging your IPG at home and adjusting programming at home. So what's next? Now that you know more about SCS, it's time to discuss the therapy with your doctor and gain a good understanding of how it might help control your pain. You'll also discuss how SCS could fit into your life and whether it's right for you to move forward with a trial.
It really gives my patients an option to control pain without seeking a surgical option that's more invasive.
I lost 5 years of my life, and I never thought that I would be back to how I used to be.
I wake up in the morning, I want to live.
I'm so happy that it's working for me.
It's beautiful. I'm seeing my wife, I'm seeing my kids, I'm alive.
Life with chronic pain is challenging, but don't give up hope. Take the next step toward moving into a life beyond pain with spinal cord stimulation. Brief summary. Product technical manuals and information for prescribers, IFP, must be consulted prior to use of this product. Indications for use. The Algovita spinal cord stimulation, SCS system, is indicated as an aid in the management of chronic intractable pain of the trunk and/or limbs, including unilateral or bilateral pain. Contraindications. Diathermy, patients who are poor surgical candidates. Warnings, precautions. Strong electromagnetic interference, for example electrocautery, RF or microwave ablation, or MRI, can result in serious patient injury or death, unexpected stimulation, or device malfunction or damage. Rupture or piercing of the neurostimulator may result in severe burns. Safety and effectiveness of SCS have not been established for pediatric patients, for use during pregnancy, or for use with nursing patients. Adverse events may include painful stimulation or loss of pain relief, hardware malfunction or migration, allergic response, and surgical risks, such as infection or additional surgery. For full prescribing information, please call Nuvectra at 1-844-727-7897 and/or consult Nuvectra's website at www.nuvectramed.com. Prescription only, February 2017.